Hi, this is Dr. Busti with High Yield Med Reviews, and we're going to answer a very important question that many of you have been asking, not only myself as I travel all over the country, but as a company, and also institutions have been asking themselves. And that is, what happened to the pass rates over the past few years and why? And then what are some things that you can do about it? So let's start off by looking at the pass rates over the past couple years. If you look back in 2012, the pass rate on average was 91.5%, 2013, 90.4%, 2014 basically stayed the same. Then in 2015, we saw a small little drop, not relatively significant, but it was in 2016 that we saw across the country a pretty significant decline in the average pass rates for the programs in the United States that are accredited. Now, we don't really know the final numbers for 2017 to see if this trend is going to continue. But I think going through everybody's mind is, why is this happening and what's going on? So you have to kind of look a little bit over the past couple of years of what the NABP has been doing to as it relates to the exam. In 2015 specifically, they changed the passing standard was being implemented at that time. In addition to that, they also changed the number of areas of competency that were going to be assessed. They did that from 3 down to 2, where 2/3 of the exam was basically about ensuring safe and effective use of pharmacotherapy to improve outcomes, and about 1/3 related to things like compounding, storage, handling drugs, drug calculations, and other things. Then in 2016, they also changed the format to the exam. They changed it from an adaptive format to a fixed form. So instead of changing the question based on how the user answers the question, it is now a fixed order and a fixed number of questions that's consistent from each exam. In addition, they increased the number of questions from 185 to 250, and they increased the length of the exam to make it up to about 6 hours. So it appears to be a more difficult exam with more case-based questions and with a changing in a standard of what is considered passing. So those are some of the reasons that we may have seen it. Now, what are some things to consider that you maybe want to think about? One is, it is clear that the NAPLEX has changed. We need to change the way we and you prepare for that test. You can no longer follow the historical method. It is not working. The standards of passing have changed. The NABP has come out and said that. It is possible that the exam is now even more difficult. And unfortunately, what I have experienced traveling around the country and talking to students and having been doing this for now 10 years is that students unfortunately are waiting too long. Remember, you can't keep doing the same things that were being done in the past. The standards have changed. Our approach needs to change. Your approach really needs to change. And I'm going to explain why that is. Okay? So what should you do now? Well, my advice to you is start early. Take this exam seriously. Do not, and I repeat, do not blow it off. You are seeing the trends. This will affect your ability to practice. It will affect your job. It will affect you to be able to make the income that you have been working hard to achieve. Do not assume also that just because you did well on your exams in your school or your program and you scored well in your rotations, that you can just walk into this test and continue to make the same grades. That is not the case, because some good students have also not passed this exam on their first run. So should I do a review course? You know, I'm a student. I've been a student in a number of areas, right? I've done training in nursing and pharmacy and medicine, and I've used review courses throughout my training. I needed them. Now, I also recognized that when I was doing some of these reviews, that there were information that was lacking that I wish somebody had told me. Especially now that the exam is more integrated in a case-based, more scenario-based, patient-oriented questions, you really need to understand how to integrate core concepts with core knowledge and the application to the clinical setting. That is what the NABP is wanting to look for. So it's really important that you recognize that you need something to help you pull all these things together. Okay, we're not going to repeat all 4 years of pharmacy school, but I recognize that I needed this. And this is one of the reasons that I developed the company as well as this review course, because I saw a need. So the NAPLEX was not written by your faculty in your school. And that's really key because, again, as you've passed the test, right, in your school doesn't mean that that's the same type of questions or the perspective for which you will be asked a question. There are a number of ways to look at a mechanism of action, and you need to be exposed to some of those other ways of looking at things. Second is differences in geographic practice patterns. You may have trained in a specific area of the country where they do things a certain way, not right or wrong. I mean, not that it's wrong. It's that they do it that way. It may be their bias towards the evidence. It may be their experience. But the reality is other places throughout the country may do it differently, and it's still accepted standard of practice. So you need to be exposed to the fact that there are other ways of doing things, and you need to receive a wide variety of information and perspectives from other people outside of your institution and your preceptors to get you to fill in all of the gaps, because you need to understand the concept. No company knows the answers to the test. No one knows what questions are going to be on the test. So you need to understand the concept and be able to look at that concept from different angles, because then you can answer any question that is provided to you, okay? And you want to increase the confidence. You don't want to go into that exam nervous and anxious. It's going to make you flustered when you start to receive those. Remember, I've been a student. I've been there, and there after the fact of taking those tests, I wished that I had a compilation of resources that helped me to think through things from different angles as a result of that. And that is what we do. So what do you get from us? We are obviously a company. We provide a review course to you. I help to develop it and as a reflection of things that I wished I had. And so I'm trying to convey this to you. I've also been faculty for over 20 years, not just in pharmacy, but in other professions as well. So I know those things that you need to know. I can explain them and make them simple. So as a company, yes, we do offer this, but it comes with a experience of what I wished somebody had told me. And these are all the things that we offer with our review course. Our review course is not just one thing. It is a compilation of experiences. Remember, learning and seeing things from different angles is key. So let's walk through some of these things very briefly so you can see what it is that we offer. You will get your own course notebook. I mean, this is a very nicely bound book that you can keep as a reference, not only for studying, but it will also walk you through the content because you get access to the lectures, assuming that you choose the right package that we offer. So it's a very good resource that you will be able to keep and refer back to, because even when you finish the exam, you're going to continue to still learn, and you may need to look back on some things as your practice and your experience increases. The next thing is we give you a study plan, okay? We know you need to get through the material so that you can make sure that you're adequately prepared. So we've set up a plan of how many lectures to go through, what questions to go through, what other supplemental material that is available out there. So we help you get through it. Second is we give you access to our practice test question database. We call that our QBank. We have over 2,000 practice test questions related to the NAPLEX. They vary in levels of difficulty from straightforward questions to very, very difficult case-based questions, right? We want you to be able to answer the questions and be able to handle any kind of format that is given to you on the exam. Now, what does the NAPLEX look like? Our QBank look like? So when you'll come in, once you have an account, you will get a dashboard that gives you access to different points. The first is our QBank. Okay, when you log into our QBank, it takes you to a dashboard, just like when you get in a car. You put the key in the ignition, you turn it on, you turn on the air conditioner, turn on the radio. You decide how you want to learn. Well, we have built the system from ground up with customized programming to allow you the control, to give you the keys over how you study and learn best. There are a lot of tools in here that are available for you. We have a My Performance report card that tracks your performance. How many questions are you getting right? How many are you getting wrong? What categories or domains are you struggling with so that you can tailor your learning? We also offer statistics on your use. How long does it take you to answer a question? Remember, the NAPLEX is a timed exam. You don't have all day to answer the question. So you have to learn how to pace yourself. And we have these tools available built into our system from the beginning that allows you to utilize it as you need it. Now, when you want to set up a testing session, we offer a lot of different modalities. You can do it in test mode or what we call tutorial mode. Test mode is where you answer the question in successive order. You get a result, just like in a test. Then you can go back and you can review the rationales that support why that question was, the answer was correct and what was the wrong answers. Or you can do what's in tutorial mode, where you answer the question, you get immediate feedback, and then you can read the rationale, then move on to the next question. It's up to you how you want to use it. We also allow you to choose questions that you've never used before versus those you have used, versus flagging questions. You have the ability to flag a question. It will save it to your account. You can only review those flag questions again in the future if you need to. It defaults to giving you 5 questions, but you can change the number of questions you receive. You can also place a timer on there. Now, we allow you to tell the system, give me whatever order you want, okay? Just like in the real test. Or if you need to selectively choose an area or domain to focus on, such as cardiology, then you can do that by selecting a subcategory. Like, I only want antiarrhythmic questions in the area of cardiology, and the system will do that for you. Now let's look at an example of what a question format looks like. So this is typically once you've started a session, you have a question, you have again the ability to flag that question to remember it later. You have this scenario and choices, and you can strike through those choices on and off by clicking on the answer choice. But let's say you answer the question and you're in tutorial mode. Well, you get immediate feedback. It will tell you whether you got it right or wrong. It will also help you to compare yourself to your peers. That's really important. How are you doing compared to other people? And then, of course, it gives you the rationale in a concise, easy to understand format that helps you to learn the concept. Remember, if you know the concept, you can answer any question that's given to you, okay? Now, it also works on devices. Our system is web responsive, and what that means is you do not need to download an app. There's no need to go to an app store, buy any apps, download an app. The website is web responsive and functions like an app on the phone. All you have to do is go to the homepage, highyieldmedareviews.com, create a push icon, put it on your smartphone or your tablet, and you can use it just like an app, log in, and the system works in that function and that format. Now, you also get access to our lectures, okay, again, depending on the package you purchase, but we offer NAPLEX review course lectures where you have an option to review content. And when you log into this area of the system, it allows you to specifically choose an area or topic that you need to use. So for example, in this, we look in the pharmacokinetics and pharmacodynamics, and you can see all the individual topics that are available for you and how long they are, and then you can sit there and watch them. And once you start them, they function at their high definition, professionally recorded videos that work on also smartphones and devices. Now, what's also relevant is that if you stop or pause because you need to go do something else, that you can resume where you left off. It tracks where you've been. And so the system is robust in ability to allow you the flexibility and the control over your learning and your schedule. And you could even listen to these things in your car. Obviously, you shouldn't watch them while you're driving, but you can listen to them and let them play in your commute or on your way into your rotation or your classes. Okay, and as I mentioned, it works on devices just like the QBank does. Now, we do offer free videos that answer very important clinical questions on our YouTube channel. You can get to our YouTube channel through the homepage, but there's a lot of very important clinically relevant things that are answered there for you that you will see on your rotations and also on your test. And so we kind of push you a little bit further than what we do in some of our other content. So I think you'll find those to be useful. Now, in addition to this, you will get a practice exam to kind of help yourself get through the material and see if you're knowing how to apply it appropriately, and that'll increase your confidence and preparation for the exam. If you attended or you purchase a package, you can either attend our live course or our live webinar classroom that will be starting in the spring. Okay, that will be a time when we pull it all together and integrate the information that you have gone through prior to that point. In addition, we make sure that the price is fair and affordable when you compare us to other products. You get all these things for one affordable price. We know that you've been in school for a long time. We know that you have debt and that you have student loans. We want to make sure that you succeed, and we offer a money-back guarantee because we believe that if you do your part, okay, you have to do your part, but if you do your part, you will pass, and you will pass the first time, okay? So why High Yield Med Reviews? Well, we're an established company. We've been doing this for over 10 years. We have established faculty with experience of over 20 years of teaching, and we know what core concepts and what things you need to know. In addition to that, we teach you to understand. I'm not interested in you just knowing a bunch of facts. I want to make sure that you understand why you do what you do and that you can articulate it and apply it to not only a test, but to real world practice. So we hold to a much higher standard and we will push you deeper than most places will push you. In addition, we provide you a complete package that helps to prepare you not only for the test, but for clinical practice. We guarantee that you will pass on the first run, and we, again, as I mentioned, it's affordable because we want you to have good quality content that helps you to get prepared for your career so that you can enjoy what you've been working hard to do for so many years and also earn that paycheck that you've been wanting to get to move on with your life. So I hope you found that to be useful, hopefully answer your question, and I hopefully provided you what we have to offer that I feel like would help you prepare for not only your boards, but for clinical real world practice.